Imagine a crime wave so vast it steals billions from taxpayers and directly threatens the integrity of our healthcare system.
Yeah.
Just last month, actually, the U.S. Department of Justice announced this record-shattering crackdown. We're talking about alleged $14.6 billion in healthcare fraud schemes.
14.6 billion. That's just huge.
It really is. And it wasn't just a big haul. It's more than double the previous record, which was $6 billion back in 2020.
Right. A massive jump.
Yeah, a huge jump. This whole effort led to criminal charges against 324 defendants. That includes nearly 100 medical professionals across 50 federal districts.
So widespread, not just one or two hotspots.
Exactly. And law enforcement seized over $245 million in, well, ill-gotten gains. Cash, luxury cars, even crypto.
Getting some of it back.
Getting some back. And meanwhile, the Centers for Medicare and Medicaid Services, CMS, they actually stopped over $4 billion in false claims before the money went out.
That prevention piece is critical.
It absolutely is. This massive scale of theft, it impacts every single American taxpayer. So this deep dive is really essential, I think, for understanding what's truly at stake here.
It's a truly astounding figure, isn't it? And it really highlights a very real and frankly persistent threat to the fundamental infrastructure of our healthcare. When you consider the sheer volume of money involved, I mean, it's clear these aren't just isolated incidents. These are sophisticated, widespread operations.
Absolutely. So today we're going to unpack how these intricate schemes operate, who they specifically target, and importantly, the aggressive data-driven strategies federal agencies are now deploying, trying to reclaim taxpayer dollars and, safeguard patient care. Let's start maybe by just grasping the sheer scale of this problem. When we talk about healthcare fraud, we're not just discussing a few bad actors, are we? This is a massive financial drain on taxpayers.
Precisely. Look, the FBI estimates healthcare fraud costs American taxpayers a staggering $80 billion annually.
Yeah, $80 billion. Wow.
Yeah. And to put that in perspective, nationally, insurance fraud eats up something like 10% of total healthcare spending each year.
10%.
10%. So this isn't just about diverting funds. It directly inflates healthcare costs for everyone. It funnels critical resources away from, legitimate patient needs. It's really a systemic issue that impacts the quality and accessibility of care for all of us.
It's not like this just popped up yesterday, right? This has been a long fight.
That's right. Enforcement efforts have had to grow because the problem itself has been escalating. We've seen significant milestones like the Medicare Fraud Strike Force. That was set up way back in 2007.
Right.
And more recently, say from 2018 up to 2025, the Healthcare Fraud Unit's data analytics team has really stepped up how fraud is detected and prosecuted, using data much more effectively.
So better tools now.
Better tools, yeah. This whole history just underscores how persistent these crimes are and how agencies constantly have to adapt their strategies. It's an ongoing battle.
Okay, so if this battle's been raging for so long, how exactly are these criminals exploiting the system today? What are some of the common schemes we're seeing?
Well, there's a pretty wide range of tactics, but certain patterns definitely emerge again and again. One of the most straightforward but still highly effective is simply billing for services not rendered.
Just making stuff up.
It's exactly what it sounds like. Fraudsters submit claims for treatments, maybe services that were never actually provided to a patient at all. They might forge signatures or even bribe medical professionals to get them to sign off, making it look legitimate on paper.
So basically getting paid for nothing. Then there's something called upcoding. That sounds a bit more, subtle.
It is a bit more subtle, yeah. Upcoding involves billing for more expensive procedures or, say, medical equipment than what was actually delivered. Think about a patient getting a standard manual wheelchair, right? But the provider bills Medicare or insurance for a high-end power-assisted one.
Okay. Charging for the Cadillac when they gave you the basic model.
Precisely. That's upcoding. It artificially inflates the cost of care, but the patient gets no extra benefit. It's just more profit for the fraudster.
And what about kickbacks? We hear that term a lot.
Yeah, kickbacks are basically illegal bribes. Could be cash payments, could be valuable gifts, even lavish trips sometimes. They're designed to influence medical professionals.
Influence them to do what?
Well, the goal is to corrupt their decision-making. Get them to use specific services, prescribe certain, often expensive drugs, or maybe refer patients for tests they don't actually need. This scheme is particularly insidious, I think, because it puts profit squarely ahead of patient well-being and, frankly, medical ethics.
Yeah, that really undermines trust. Now, here's where it feels like things are really changing. With telehealth booming, telemedicine fraud has become a big deal, hasn't it?
Oh, absolutely. Criminals are really exploiting the convenience and, the reach of telehealth. They're billing for consultations or tests that either never happened or were completely unnecessary.
Just over the phone or video call.
Right. And the recent 2025 takedown we mentioned, it saw an incredible $1.17 billion in fraudulent claims tied directly to telemedicine and genetic testing schemes.
1.17 billion. Just from that.
Just from that category, it shows how fast criminals can pivot to exploit new technologies, new ways of delivering care.
And that ties right into fraudulent genetic testing, which sounds particularly nasty, often targeting vulnerable people.
It is deeply disturbing. We've seen awful cases where, say, elderly patients or others who are vulnerable are lured into getting genetic tests they absolutely do not need, and then federal programs get billed billions. I mean, we've seen schemes involving just a handful of doctors allegedly generating tens of millions in false claims. Yeah. Folks like Dr. Sikhar Rao and Dr. Vinay Paramaswara allegedly over $36 million in false claims between 2014 and 2016. Or Dr. Daniel Conchola supposedly causing over $69 million in false claims in just about a year, getting kickbacks for unnecessary tests.
69 million.
And Jamie Simmons allegedly billed Medicare over $56 million for fake cancer genomic tests. Another doctor, Matthew Ellis, apparently ordered $4.6 million in tests Medicare paid for without even interacting with the patients.
Wow, just ordering tests blindly for kickbacks.
Essentially, yes, these aren't small-time scams. They're highly organized operations preying on people's trust and fears about health.
That's awful. And then there's the long-standing, devastating issue of prescription opioid trafficking.
Right. This involves illegally diverting and distributing controlled substances, painkillers, purely for profit. In that same 2025 takedown, 74 defendants, including 44 medical professionals, doctors, nurses, were charged.
44 medical professionals.
Yes. Charged with diverting over 15 million opioid pills. So this scheme isn't just defrauding the system, it's actively fueling the opioid crisis, which just compounds the damage.
Just to give everyone listening a concrete example of the scale and, well, the audacity here. Let's look at a $175 million compounding fraud case down in Florida. Between 2013 and 2015, a few individuals used call centers and kickbacks just to generate fake prescriptions for specialized compounded drugs.
Right, often very expensive ones.
Exactly. They ended up scamming government and private insurers out of $175 million.
Yeah.
And they specifically targeted TRICARE, the military health care program.
Targeting military families.
Yeah. The main players got pretty hefty prison sentences, 10 years, 8 years, 30 months. It really shows there are severe consequences, but also the sheer size of these operations.
That case is a classic illustration, really. A complete fraudulent supply chain, from faking the prescriptions to targeting specific drugs and payers they knew would pay out big. It just demonstrates how organized and, frankly, sophisticated these criminal networks can be.
And that brings us right back to the recent 2025 National Healthcare Fraud Takedown. This was clearly a powerful, record-breaking response. What made this particular enforcement action so historic?
Well, the 2025 takedown is truly unprecedented in its scope, charging 324 defendants with over $14.6 billion in alleged fraud.
$14.6 billion again, just staggering.
It is. And to put that in perspective, like you said, it's more than double the $6 billion charged back in 2020. And it's a huge leap from just the year before. 2024 saw about $2.5 billion, same for 2023.
So a massive increase recently.
A really sharp rise in enforcement action. One source even noted, and I quote loosely here, that the increase in enforcement was significant, highlighting this clear intensification of federal efforts.
Now, what's particularly alarming in this latest takedown is the growing focus on transnational criminal organizations, TCOs. This isn't just a domestic problem anymore, is it?
Not at all. That's a really key point. The 2025 takedown charged 29 defendants specifically for their roles in these TCOs, allegedly submitting over $12 billion, the vast majority of the total in fraudulent claims.
$12 billion from transnational groups.
That's the allegation. A prime example they highlighted was Operation Gold Rush.
Oh.
This uncovered foreign straw owners buying up dozens of U.S. medical supply companies. They then allegedly submitted $10.6 billion in fraudulent Medicare claims using over 1 million stolen American identities, then laundered the money through crypto and shell companies overseas. It's a truly global network exploiting our system.
1 million stolen identities. And it gets even more sophisticated, right? We're actually talking about artificial intelligence being used by the criminals now.
Precisely. That's another deeply concerning trend. We saw reports of Pakistani marketing organizations using AI quite notoriously, actually. They created fake audio recordings, deep fakes, essentially of Medicare beneficiaries supposedly consenting to products they never asked for.
A consent recording.
Yes, leading to $703 million in fraudulent claims based on this AI-generated proof.
Unbelievable.
And what's also just deeply disturbing is how these organizations targeted vulnerable populations. One particularly shocking scheme involved a $650 million plot. They recruited patients from Arizona's Native American reservation. Some people were reportedly homeless, got their information, and then billed for substance abuse treatment that was never actually provided.
That's just exploitation at its worst.
It really is. A stark reminder of the human cost when profit motives completely override any sense of patient care or decency.
But amidst all this, the enforcement efforts are yielding real, tangible results beyond just the charges filed.
Yes, absolutely. The takedown led to the seizure of over $245 million in assets. That's cash, luxury vehicles, crypto, as you mentioned, actively returning funds to public coffers.
Okay, so clawing some money back.
Right. And beyond the criminal charges, 20 defendants face civil charges related to about $14.2 million in alleged fraud. And another 106 defendants reached civil settlements totaling $34.3 million.
There's elections, too.
Yes. And importantly, that prevention piece we talked about, CMS, proactively suspended or revoked the billing privileges of 205 providers. And they prevented over $4 billion from being paid out in the first place in response to identified false claims.
$4 billion stopped before it went out the door.
Exactly. It shows a real commitment now to stopping fraud before it happens, not just chasing the money down after it's gone.
That feels like a crucial shift, doesn't it? Stopping the money leaving the system. So looking ahead, what new strategies are these federal agencies using to protect taxpayer dollars, protect patient care? It sounds like they're trying to move from reacting to preventing.
That's exactly right. The Department of Justice has been pretty explicit about moving away from what they call a reactive pay-and-chase model.
Pay-and-chase,
Okay.
yeah.
Moving towards a much more proactive, data-driven approach. The primary goal now is to prevent the fraud before it results in these huge losses. It signifies a really fundamental shift in how they're tackling the problem.
So how are they doing that specifically? What does that look like on the ground?
Well, a key new initiative is the Healthcare Fraud Data Fusion Center. This is really interesting. It brings together experts from DOJ, HHS, OIG, that's the Inspector General's office, and the FBI.
All working together.
All in one place, essentially. Their mission is to leverage advanced tech, think, cloud computing, artificial intelligence for much faster fraud detection. And crucially, to dismantle the criminal enterprises behind the fraud more effectively. It's about breaking down those old information silos and spotting emerging schemes much, much faster.
Using AI to fight AI in some cases.
Potentially, yes. Using data analytics in a much more sophisticated way.
Okay, so beyond this new fusion center, what specific areas are getting the most scrutiny from, say, the HHS, OIG? Where are they focusing their audits and evaluations right now?
Their public work plan highlights several high-risk sectors that are definitely under continuous scrutiny. Telehealth is still a big one. They're looking hard at arrangements with very little actual patient contact or compensation based purely on volume, looking for those unprovided or unnecessary consultations.
Makes sense.
Durable medical equipment, prosthetics, orthotics, and supplies, DMPOS, that's another huge area. Over $7 billion in Medicare payments annually, so it's a constant target. Think unnecessary orthotic braces, ventilation devices billed without proper sleep studies, billing for equipment while a patient is actually in the hospital.
Things that shouldn't happen.
Exactly. And given what we discussed earlier, genetic testing and laboratory services remain a major focus. OIG is reviewing Medicare payments for lab tests, looking at those COVID-19 add-on payments, urine drug testing, checking for improper billing, lack of medical necessity, missing documentation.
Okay. What about nursing homes and long-term care? That seems like a vulnerable spot.
Absolutely. Long-term care and nursing homes are under extensive review. Audits are looking at compliance with safety programs, investigating drug overdoses, checking the accuracy of falls reporting, making sure nurse staffing hours are adequate and reported correctly. They're also checking that emergency power systems are reliable. And, significantly, reviewing the potentially inappropriate use of antipsychotic drugs, especially for residents who don't have a relevant diagnosed condition like schizophrenia.
That's a really important check.
It is. And finally, given the huge influx of funds during the pandemic, the provider relief funds distributed under the CARES Act are also a big focus.
Making sure that money went where it's supposed to.
Precisely. Audits are ongoing to ensure the funds were calculated correctly, properly documented, and actually went to eligible providers. It's about accountability for those emergency taxpayer dollars.
So ultimately, for the people and companies caught doing this, what are the consequences? It sounds like they're pretty severe.
They are indeed severe, and they come in several forms. Individuals can face serious criminal charges and lengthy imprisonment. Sentences can go up to 10 years, even 20 years if serious bodily injury results from the fraud, or potentially life imprisonment if it causes a patient's death.
Like those Florida sentences we mentioned.
Exactly. Significant prison time is definitely on the table. Beyond that, there are substantial fines and restitution orders. They're required to pay back the money, often accompanied by asset seizures, taking the cars, the cash, the crypto, everything to recover those ill-gotten gains.
Hits them financially, too.
Hard. There are also civil penalties, which can lead to large financial recoveries through lawsuits and settlements, separate from criminal charges. And for the medical professionals involved, it can absolutely be career-ending. They can lose their medical licenses and be excluded from participating in federal health care programs like Medicare and Medicaid forever, which effectively removes them from the healthcare industry entirely.
So the stakes are incredibly high for perpetrators. Well, this deep dive has really exposed the staggering, almost unbelievable $80 billion annual cost of healthcare fraud. It's a direct assault on our national resources, on taxpayer trust. We've seen how these sophisticated criminal networks exploit everything from telehealth to genetic testing, siphoning billions through really intricate schemes. Yet it's also clear federal agencies are fighting back hard with these record-breaking takedowns and new, cutting-edge, data-driven strategies, even leveraging AI themselves now, it seems, to proactively protect our healthcare system and our tax dollars. It really is a battle fought with vigilance and technology.
That's precisely it. And it leaves you wondering, doesn't it? With new advancements like AI being used more and more by both the criminals to defraud and law enforcement to detect, are we just entering an era where this fight against healthcare fraud gets won? Or does it simply transform into this ever-evolving digital arms race, perpetually impacting the cost and, maybe more importantly, the confidence we all have in our healthcare system? Your awareness, reporting suspicious activities you might see, it remains a really critical line of defense in this ongoing battle,